Good afternoon. My name is Lucy Aquino, and this is a live show coming to you from Can Cable 21. Today, I have with me Maria Oquendo, co-worker. Welcome, Maria.
Thank you.
On behalf of Illinois Masonic Medical Center, Gottlieb Memorial Hospital, Hispanocare, thank you for tuning in. Today's topic, actually, we're going to be talking a little bit about everything. We are at the busiest time of the year for community health. And today we're going to be talking a little bit about the upcoming events that are happening and taking place, especially with our community health fairs. So Maria, let's talk about this wonderful event that we do every year. And it's actually coming up this coming Saturday, June 15th?
Yes, June 15th, we're going to be in Melrose Park. And we're going to be inside Continental Furniture, which is located inside the strip mall that's there, where the Big Tony's is
Right.
at. So it's on Mannheim Road.
North Avenue.
Right.
North Avenue, right?
North Avenue
Melrose
in
Park.
Mannheim, right.
Now, I know that this is an event with Maria Oquendo, which is a local merchant who's actually partnered up with Hispanocare, Gottlieb, and Illinois Masonic for the last about 20 years now.
Just about.
And we've been providing community outreach and education and prevention programs and screening programs that will be taking place this coming Saturday, the 15th of June, at 1921 North Mannheim Road.
Right.
And one of the great things about community health, obviously, is that all the free screenings that we do.
Oh, well, free screenings, we have resources, we have something for everyone, every age range, from children up into our seniors. So there's always something for everyone at all the different community events that we do, especially with our health fairs.
Right.
We host so many throughout the year in different many areas, like for instance this one that we're doing this Saturday in Melrose Park, amongst others that we do in Pilsen.
Right.
We do Logan Square,
Humboldt Park,
we
back
do
of the yards,
exactly. So
Little
we're
Village. We're kind of a little bit throughout the city
exactly.
and the surrounding suburbs. But I'm really excited about Saturday's fair. I want to talk a little bit about some of the resources that are going to be there that are really going to be vital to the individuals who are attending, especially as everyone's talking about healthcare reform.
Right.
This is something that's happening soon. October 1st is the opening for registration on what everyone's calling Obamacare. And this is healthcare reform we hope will go as smoothly as they hope it will go.
Right.
But this is an opportunity for those who are uninsured, underinsured, those who don't have access to health insurance now, who could qualify for health care coverage. Now, on that day, Saturday next week, we're going to have one of the community organizations there who's going to be providing information, details, enrollment, which actually they're doing enrollments now in some cases.
Right. They're doing enrollment. The program is actually called County Care, and they will be on site, and they will be able to provide information as to how the program works, who qualifies, all the guidelines. And it's really a wide range of opportunities, not only with county care, with health insurance, but also with a lot of the other resources that are there.
Right.
You're able to go there, you think just for one particular resource or one particular type of information that you're looking for, and you end up leaving with just so much more.
Various things that you can walk away with. Now, not only do we have Comfort Care that's going to be there, County Care is going to be there.
Right.
The providing that information for enrollment, whether it's currently happening now in some cases, and for example, all kids or the Illinois ILCHIP is for child
It's the child identification
kits
Right,
that we'll be providing as well. Now, that's
hugely
a really
important.
big deal, Maria.
It's huge. Being
It's
a
a big
parent,
deal.
we're both
Yes,
parents, so
yes.
we know. I have a small child. Definitely with ILCHIP, with working with our Masons, we definitely want to impart upon parents how important it is, you know, the safety of our kids. And obviously with parents, we cannot keep an eye on them 24 hours a day, 7 days a week with as much as we would love to. In the event that something were to happen, the Masons with the ILCHIP program provide an identification kit, which is wonderful for parents. It's absolutely wonderful. And it provides you with a 30-second DVD copy of your child to show their height, They have a height chart behind them,
Right.
to show how they speak, how they stand, their mannerisms. Along with that, they have an actual
Hair
DNA
color,
swab,
eye color, just
everything,
you
all
can
facial
possibly
features,
imagine, absolutely.
and you get DNA swab, you get actual fingerprinting, and these are not things that are given to the parent to actually take home and complete. Everything is done right then and there. And it's all given to the parents, so no information is actually kept with the Illinois Masons group.
And I think that's really important to know, because a lot of times as these events happen throughout community and these types of child IUD kits are being made to the public for parents, for their children to have, and it doesn't matter how many children you have, they'll be more than happy to give you a kit for each one of those children, I should say. And what's really, really important is that we as parents, do not take this and put it in a drawer and forget about it.
Exactly. The Masons, they definitely tell you, please keep it. Do not keep it in a safety deposit box, even though it is very important.
Right.
You want to have it readily available in the event that you need it.
Which we hope no mother or parent should ever need a child identification kit.
We want to be able to, they want to be able to provide you with this wonderful piece of information, this resource, these collective amounts of things that could potentially save your child or in the event identify your child. But in regards to usage, we hope you never have to use it. But in the event that you do, you have it readily available.
Absolutely. It's better off that a parent has some sort of something.
Exactly. It's better to have it than to need it.
Right. Absolutely. Now, Maria, we talked a little bit about too, to make sure that these things are not, put away and forgotten about. It's definitely something you want to put in a safe place that's accessible, and that should you need it, you can easily obtain it. Now, the other thing, too, is that it's important to know, parents who are watching, our viewers who are watching, is that, as Maria alluded to earlier, none of this information is kept on any database. None of it is kept by the Masonic Lodge, who is sponsoring this for community, and it's been a pleasure working with our Masonic Lodge and providing this for a number of years now. Whether they have screened hundreds and thousands of kids, providing these types of kits for parents. And again, like we said, we hope that no parent will ever have to use it. It's free of charge. It's available to you. Come out, take advantage of it. It's definitely something that's going to be provided. Now, we're also going to be there is going to be all kids.
Right. We'll have all kids. And I'm sorry, there is another important part about the child identification kits that we want to make sure that we let parents know, that if in the past you actually have taken advantage of gotten this identification kit, kids, they grow up so fast.
Yes.
We see them every day, so we may not notice their change, but we encourage you, if you have taken advantage of the identification kits and gotten one for each of your children, please come back and do it again.
And it's free.
Every year, please come back, because you could have held on to it from 3 years ago. In 3 years, your child has changed so much. Their mannerisms, their hair color. My child had blonde hair when he was born. He has brown hair now. So please definitely come
look
out.
At height and weight and everything else.
Exactly.
It's just a complete change. Children change all the time. So it's important to renew these kits every year. And again, but it's really, really important that you know that no one keeps any of this information on file.
Yes.
Everything is done in front of you. Everything is handed to you upon completion in a nice Ziploc safety bag. Everything in one package where you put it away. So please come and take advantage of it. Now, going to All Kids.
Right.
Illinois has a program called All Kids, obviously, for those individuals whose children do not have health insurance. Every child is entitled to health care coverage. And obviously, All Kids will also be there to provide that information and help you enroll to get your child covered in the event you don't have health insurance for that child.
Exactly.
Which can take advantage of that now, and that child can be insured now as well.
Exactly. Yeah.
Immediately, right? We do know that blood pressures going to be provided. Diabetes screenings, glucose screenings will be provided. We're also even providing free giveaways with diabetic glucose meters to the first 50 people who test for high glucose levels. They'll be getting a free meter. Retail value is about $80 to $100. It's a free meter. Get you started with some strips as well. And at the same time, teach you how to use that meter. Obviously, prevention is key. We know we have epidemic proportions of obesity. Hypertension is up on the rise. Heart disease is on the rise. Diabetes, it's already in epidemic proportions. Definitely something to come and get screened for.
Exactly. Yeah, and it's all free of charge. It's open to everyone. So why not take advantage?
Absolutely. Now, glucose screenings, as we mentioned, the meters for everyone. We're also going to be having confidential HIV screenings as well.
Exactly. Yes.
Now, we're sponsoring, partnering up with the Core Center on that?
Yes. The Core Center is a wonderful organization that comes out. They're a community-based organization. They come out to not only our events, but a host of other community events that are out there. And you're able to do an oral swab. So have no fear if you don't like needles or blood or anything.
None needed.
You don't need any of that. It is a 20-minute rapid test.
Right.
So all it is just an oral swab inside of your mouth that you handle. The actual technician does not handle it.
Right.
So it's given to you. You do the process. It's very easy. They time it. After 20 minutes, you're able to come back and get your results.
Right.
And then if there's any questions, any information, they also provide pamphlets, both
The
in English
social
and in
workers
Spanish.
are there as well for counseling, should you require it.
Right. So any questions, any concerns, any they'll do myth busting there as well. So if there's anything lingering, not necessarily just with testing. Let's say you want just your questions answered.
Right. You don't want to be tested, but you have questions. They'll be there to help you and answer those for you as well.
Right.
Yeah, it's really interesting. I remember back in the day when the epidemic was rampant, and screenings, first of all, costly. So costly to be screened for HIV.
Exactly.
At the same time, it was weeks before you got results. In some cases, and depending on where you're coming from, it's even months and so on. And it's just, technology has come such a long way where we can do a rapid testing and you can get your results in 20 minutes.
Right. 20 minutes versus weeks.
Right. Interesting.
Right.
Free of charge. Again, free of charge. So you've got blood pressures, you've got cholesterol, you got glucose screens, free meters should you require one. You've got the ILCHIP with the Masons, our Masonic Lodge, and we love working with these gentlemen, and they're so good at working with the kids and their families as well. And then we have all kids, health care for all kids. Every child should have health insurance. Now, Maria, I know that for those individuals who are watching, if you should have more questions, you can always call the Hispanocare office. You can reach us at 773-296-7157. And we are a program of Advocate Illinois Masonic Medical Center affiliated with Gottlieb Memorial Hospital. Should you want to receive our schedules of community events, or should you want to find out more about what we're doing in community, please give us a call. You could also visit us at, Maria?
You can visit us at www.hispanocare.org. All our community events are listings of not only health fairs, but upcoming seminars and lectures. We have a host of different things coming up all the way through November.
All right. Now, I know we have, all right, so we have the health fair that's coming up this Saturday.
Right.
Now, the event is from 10 to 2. Let me put this back up there over again. It's the Community Health Fair, and it's Saturday, June 15th, 2013, here at Muebleria Continental, or Continental Furniture, located at 1921 North Manheim Road in Melrose Park. It's roughly the corner of North Avenue and Manheim.
Right.
In the shopping center there. You will see it. I'm sure you'll see balloons and so on. And you'll be receiving all of these services completely free of charge and a lot more. Now, Maria, I know we didn't mention, we also have spinal checks, don't we?
Yes, we do.
And what does that entail?
Well, a lot of us tend to suffer from back pain for different reasons, whether it be from maybe being a little bit too overweight, maybe a little too top heavy, and all of that pressure gets put on our spine.
Right.
So we'll have a chiropractic there as well to be able to check your alignment, to see how well it is that you're standing, your proportions.
Right.
And most people tend to really like it. They don't realize that they tend to walk more on their right side more on their left side. And they're given little tips and techniques, maybe a little bit of diet, exercise, the do's, the don'ts, all these different things.
Right shoes, wrong shoes,
right.
Too high, too low.
Oh, the too high, definitely with women. We, not them, we tend to wear a lot of high heels. So all of our pressures tend to be put on the tips of our feet. So a lot of that is we have pressure on our backs.
Right.
So there's wonderful. I mean,
now we're partnering up with, who's our doctor in that day?
Dr. Zhao.
Dr. Zhao is coming out. I love working with Dr. Zhao. He's just absolutely wonderful. Really committed to providing services to the community. And again, Continental Furniture as well. It's been a partner of ours for 20 years. We've been partnering with them and giving back to community. Mitch Portugal, the proprietor of the Continental Furniture, has just been absolutely wonderful with community and giving back.
Yes, he has been a great supporter.
Absolutely. Now, I know, Maria, we talked about some of these things, but there's going to be a whole lot of different resources there, too.
Yes.
Can we talk a little bit about some of them?
Sure. All right. So we have, not only do we have the ILCHIP, the identification people, we also have the All Kids.
All right.
The insurance for children, and we have county care. So overall, we have health insurance covering you from
head to toe.
Head to toe, inside and out. We have you from little children to the adults.
Right.
So we'll have those information there. We also have infant safety with SIDS of Illinois will also be there. We have HIV, AIDS, STD information, how to protect yourselves. We will also have
IPC,
yes.
So we're dealing about poison control.
All protection.
Absolutely.
Not only do we protect children with giving parents, adults in general, information on how to protect yourselves, but also to protect your home. Some other things that you may not realize when it comes to children, especially with poison control, plant safety, and medication safety. All of this information, all available, all of our resources, our screenings, English and Spanish.
Everything we do is in English and Spanish.
Yes.
Absolutely.
So we encourage everyone to be able to come out and partake in that. We have Vital RX Pharmacy, who they're just coming out.
Right.
They're coming out to provide the information, and they'll be giving out information on vitamins, which vitamins are actually necessary. There's so much information out there. Take this vitamin, take that vitamin, and there's
and there is such a thing as taking too much of anything. And taking too much of anything is not always good for you.
Right. So we'll be able to. They will be able to take care of those. Right.
Absolutely.
And give you the information. Get a little packet of vitamins as well.
So all kinds of freebies, all kinds of giveaways,
and we'll help you find.
Great.
Yeah. And not only just all the giveaways and information, will help you be safe, plant safety with children, with adults as well, information on insurance for children and adults. But we will also be able to help you with the iCash, Illinois Department of Treasurer, to see if you found any.
Now that was formerly.
Cash Dash.
Cash Dash.
Yes,
or cashdash.net.
Yes. So they've changed the name to
iCash.
iCash. Yes. And they'll be able to locate any missing money.
And what that means is that basically, for those of you who are not familiar with that, they can basically take your name down or your information, and let's say that maybe you had a bank account that your child had as an infant, and you totally forgot about it. Put in your information. It's going to pop up and say, gee, someone's holding for you a few $1,000s, a few $100s, whatever it is.
Exactly, yeah.
You can claim it right there and then, fill out the necessary paperwork. They'll cut a check. They'll send it out to you. Let's say somebody has passed and left you maybe some sort of inheritance. You didn't know about it. Yes. Same thing. They can also check that for you.
Yeah, but not also is it relating to banking, but it also relates to stores because I am... a recipient of that. I checked it because I thought, well, I'm going to give it a shot, and they're never going to find anything. I actually had some money left over from a department store that they had owed me.
So you had a credit coming to you.
Yes, I had a credit coming to me, and they were going to. I had to fill out the proper paperwork,
right,
and they would issue me out a check.
Right, and it doesn't take any time at all whatsoever. Right. And so with that. That's just such an interesting thing to do. So please come on out, join us again. Please join us at our community health fair coming up Saturday, June 15th, at from 10 to 2 at Continental Furniture at 1921 North Manheim Road. Please join us. Dr. Candido, welcome.
Thank you, Lucy.
Thank you for coming.
A little bit late.
That's quite all right. You're here, and that's the important thing. With me today, this afternoon, we also have, you met Maria. We talked a little bit about what's going on there. And so our lines are open for questions and answers should you want to take those, put in those calls. So right now, again, let me introduce
Thank you.
Dr. Kenneth Candido, anesthesiologist with Illinois Masonic Medical Center. And thank you for being on the show.
Thanks for having me, Lucy.
Oh, good. It's good to see you always.
Good to see you
Always
as well.
such a pleasure. Absolutely. So, Dr. Candido, one of the things I wanted to bring you back and talk a little bit about, because the last time you were on the air, we talked about pain management.
That's correct.
And it just seems that you're hearing so much more about that. More and more folks are just complaining about pain.
Well, that's a great topic, and clearly, not only in the economy being down a little bit and people being out of work, but people are suffering all over this great country of ours, and there are a whole host of factors that I think are responsible for that. Nothing to pinpoint per se, but we've got individuals all over the place who are hurting out there.
So, when we talk about pain management, Dr. Candido, I mean, really, what is pain management?
Pain management is what we do and what we focus upon when we examine and evaluate people who are suffering. And basically they're suffering for a variety of reasons: spiritual, mental, physical, psychological. But mostly we try to focus on the physical, because if there's a process that's reversible, if there's something that we can address and remove a focus of their life that's causing this distress, then in many cases we're capable of or able to turn around what appears to be a hopeless or a helpless situation and actually make it more of a functional situation for people.
So, a pain management specialist is a doctor with a particular degree, credentials?
Well, anybody can be a pain medicine or pain management doctor, and we have psychiatrists, physiatrists, anesthesiologists, and even surgeons, of course, who can practice pain management. Essentially, all it takes is an appreciation of the nervous system, the musculoskeletal system, as well as the physiology and the pharmacology of a wide variety of chemical agents that we can use to pretty much attempt to abolish the pain, or at least make a reduction in someone's symptoms. We can't always be 100% successful, but in many cases we can make a significant, substantial difference. And so anybody can be a pain management doctor, as long as they have, of course, either a degree in allopathic medicine, the MD degree, or osteopathic medicine, the DO degree.
Oh, okay. So, Dr. Candido, I want to remind our viewers that with me today is Dr. Kenneth Candido, pain management anesthesiologist with Advocate Illinois Masonic Medical Center. Our lines are open should you have any questions, and that number's at the bottom of your screen. So if you have any questions for Dr. Candido, please feel free to call us.
Call us.
Please. That's why we're here. We want to make sure that we can educate our viewers on all kinds of things, and today in particular, it's on pain management. So, Dr. Candido, what are the goals of pain management?
The goals are to reduce suffering and to improve or restore functionality. So it should never be, I think, assumed that we're merely attempting to try to block a symptom or a subjective process where somebody doesn't feel well. We're also trying to get people back to their baseline level of functioning. Because without functionality, of course, what is pain management? It would be simple to give somebody a large dose of a narcotic, for example, and put them to sleep, but that's not functionality. We're trying, in the framework of getting people back to the workplace, interacting with their loved ones, having their significant others be more responsive to, as well as interact with them. Pain management encompasses much more than just providing a pill or a tablet or a capsule. We do much, much more than that.
So, Dr. Candido, pain treatment, how is that guided?
It's guided by symptoms, but also by some of the results of diagnostic studies that we may ask our patients to undergo. We try to match up the organic or the objective findings, meaning what we can actually see, the black and white, the MRI scans, the other objective tests with their subjective complaints. And when we're successful in making a match, it's just a matchmaking deal purely and simply, then oftentimes we can find a remedy or a cure or some type of resolution for that process.
Now, there are different types of pain. I mean, everyone can complain about this and that, but there's all different types of pain. And how is something determined? The source of pain, the type of pain? How do patients describe it, or how should they describe it?
Well, they should basically use their own language and their own words to express themselves. But you're right, there are nociceptive pain types, which is the kind of pain that occurs, for example, after you stub your toe or bang your thumb with a hammer. And there's neuropathic pain types, which is an abnormal functioning of the nervous system. And we see that in individuals, for example, who have medical conditions, diabetes, where the small nerve fibers are involved, or somebody who's had an amputation and they develop what's called the phantom limb pain, or somebody who sustained often a work-related injury and they develop something called a complex regional pain syndrome. So we have both pain that's nociceptive, meaning that there's a stimulus and a response. The purest, most, I would say, the simplest expression of the nervous system that exists. And then we have neuropathic pain, which is abnormal type of pain, meaning that under usual circumstances, those nerves should not be hurting.
Oh, wow. So it can just go from one extreme to the other. And I like the examples you give, because obviously stubbing your toe or hitting it with a hammer, it's a pain that eventually will go away.
That's correct.
Versus something that's diabetic related, which will always be there.
May be there for the entire life of the individual, unfortunately, regrettably.
Right. So can you give us, you gave us some causes of pain. Most recently, I'm hearing a lot on back pain.
And you're right. I would have to say that amongst the industrial types of injuries that we see or in the workforce, as well as what we see in a pedestrian population, back pain is ubiquitous. We find it throughout all stratas, all socioeconomic groups, all cultures, races, religions. People are going to suffer from back pain. Even they actually did an interesting study on some of the mummies that they found in Egypt, and they put those mummies under CT scans or MRI scans and found they had degenerative intervertebral discs. So we know that degeneration of the spine, the spinal column, the discs, the nerves, and the elements, the ligaments and tendons, is a natural process of aging. Everybody's going to have back pain at one time or another. It's what you do about it that matters.
Right. Well, Dr. Candido, our time goes it goes so quickly. We didn't get enough time to talk about the things I really wanted to talk about, and I'm hopeful that you will come back and join us relatively soon so we can catch up and pick up where we left off.
Hopefully I'll be on time this time, Lucy. Absolutely.
No, that's quite all right. I know traffic is horrible out there. But I do want to remind our viewers that if you have any questions or you'd like to speak to Dr. Candido, Dr. Kenneth Candido, pain management anesthesiologist with Advocate Illinois Masonic Medical Center, located at 300 North Austin. And if you have any questions, please give him a call.
Please call.
773-296-7937. Again, that number is 296-7937. We all experience pain to a greater or lesser degrees at various points of our lives. It is sad that pain is the most common reason patients seek medical attention, but each of us perceive it as a given pain stimulus.
I agree, Lucy, and a wise person once told me that pain is inevitable. We're all going to experience it, but suffering is optional. You don't have to suffer. If you come and visit us or people who do the kinds of things that we do, then in many cases we can abort that suffering and make you more functional again. Please don't forget.
Absolutely, many options out there. Find a good physician. Find that treatment. You do not have to suffer.
Thank you.
Going through that.
I agree.
Thank you, Dr. Candido.
Thank you, Lucy.
On behalf of all of our colleagues at Hispanocare, Advocate Illinois Masonic Hospital, Gottlieb Memorial Hospital, Dr. Candido, thank you so much. We want to thank you for joining us today. My name is Lucy Aquino with Hispanocare at Advocate Illinois Masonic. And until next time, we'll see you real soon. A lot more information coming your way. Please stay tuned. Thank you for watching CAN TV Cable 21. Till next time.
Thank you.